Take note, the T3 and T4, they are hormones, they are not cells. Okay, so the thyroid gland, within the thyroid gland, we have two types of cells, the follicular cells, and then we have the parafollicular cells. The follicular cells, and we have the parafollicular cells. Okay, so the follicular cells are the cells in the thyroid gland that secrete the T3 and the T4. And the parafollicular cells are the cells in the thyroid gland that secrete calcitonin. Is that okay? So if I ask you, how many cells do we have in the thyroid gland? There are two cells, follicular cells and parafollicular cells. Okay, let me ask you this. Mention 3 hormones produced by the thyroid gland. What will be your answer? 3 hormones produced by the thyroid gland.
Triiodothyroxine, and calcitonin.
Okay, so triiodothyronine, tyrosine, and calcitonin. Is that okay? Okay. Mention the 2 cells within the thyroid gland. 2 cells within the thyroid gland.
Follicular cells and parafollicular cells.
Good. So follicular cells and parafollicular cells. Okay. What hormone is produced by parafollicular cells in the thyroid gland?
Say T3 and T4.
It's not true. Parafollicular cells.
Sorry, calcitonin.
Calcitonin. Okay. What hormones are produced by the follicular cells in the thyroid gland?
Is T3 and T4.
T3 and T4. Is that okay? Yeah. So you have to know all these dynamics, please. Specific. You have to know them specifically. Is that okay? Now, what you should know is that, so the thyroid gland produces, within the thyroid gland, we have 2 cells, follicular cells, parafollicular cells. The follicular cells produces the T3 and T4. The parafollicular cells produces calcitonin. So all that we are saying is that, say, your thyroid gland in your cells mean into say the thyroid gland in it here, where your thyroid gland in him. Both the cells are hold on mean into or the eye red and white, and then you find the parafollicular cells. The dinfo fresh and the friend obey me from C cells. Is that okay? So into women you from C cells and our parafollicular cells. And the eye can see orange ones, and then you from follicular cells. Omo produce T3 and T4. Okay, into thyroid gland when you run cells okay, you run cells so the cells, your follicular cells, okay, and your parafollicular cells, okay. Follicular cells some produce T3 and T4. Parafollicular cell no produce calcitonin. Into a bizarre cell but hormones are thyroid gland they produce produce hormone miensa. Follicular cells ni produce mienu T3 and T4. Parafollicular cell ni produce bako and then you find the calcitonin. Okay. T3 and T4 no ede adwuma no moye. Adwuma moye ne say obetimia ohomia be kosra e T3 and T4 na ye ho adwuma. Ubipi be kosra e T3 T4. Ubetimia didi ye T3 T4. Ubenya sexual libido a T3 T4. Is that okay? Or digestive system be regulating ye T3 T4. Is that okay? What that means is that say patient wo ho na ni T3 ni the T4 e kosra. So patient obenya a lot of appetites, increased appetites. Again, T3 T4 so na a regulating body temperature is responsible for metabolism. So it plays a role in regulating your body temperature. Into say T3 ni T4 e kosra. Say you call your body ni inside that or temperature very high. T3 ni T4 kosra. You call your body ni inside that or temperature very high. As such as say a patient you need to say patient ni T3 ni T4 na kosra. So patient no the call or the right down a why share if why is it that the person will not be able to cope? The reason is because there is already heat is being generated in the body already. Is that okay? Heat is being generated. So if you take that person to an environment that is very hot, they will not be able to cope. And in medicine, that is what we call heat intolerance. Heat intolerance. Is that okay? So if a patient is having a condition like hyperthyroidism, the thyroid gland will be producing more of the T3, will be producing more of the T4. So at the end of the day, what is going to happen? Your breathing rate will increase. You remember I told you that what is the function of the follicular cells, the thyroid gland follicular cells? They produce T3, T4. The T3, T4, they increase your respiratory rate, they increase your pulse rate, they increase your BP. They can also, in fact, they will increase your body temperature. Is that okay? And if your T3, T4 levels also go up, you may even sweat. Is that okay? Yes. And sometimes you even get palpitations if it is going so high. Is that okay? Like that is what we call hyperthyroidism.
I have a question.
Yes, please ask your question. Ask your question.
The follicular cells which produce the T3 and T4, can you say they are responsible for metabolism?
Good. Yes, the T3, T4, they are responsible. Metabolism is what we are breaking it down. When we say metabolism, that is, it has got to do with your respiratory rate, your pulse rate, your BP, your body temperature. Metabolic activity. That is why we call the thyroid gland the gland of metabolism. It's okay. So, respiratory rate, or BP, or body temperature, how are we your digestive system activities? Activities medicine your friend in metabolism. So, in summary, you can also say that the thyroid gland, the T3, T4 are responsible for metabolism. But you should know what the metabolism means. Okay, so they are responsible for controlling your breathing rate, your respiratory rate, your BP, your heartbeat. You get it. Your body temperature is your appetite level, is your thyroid gland, your digestion is your thyroid gland that is responsible for all of these activities. And then the parafollicular cells lowers your blood calcium level. Say this after me. Parafollicular cells in the thyroid gland lowers blood calcium level. Say it. Please say it after me.
Follicular cells in the
thyroid gland
Lowers your blood
lowers the
calcium
blood
level.
calcium level.
Parafollicular cells in your thyroid gland lowers your blood calcium level. Say it for the last time.
Parafollicular cells in the thyroid gland lowers
your
blood calcium level.
Okay, that is fine. Okay, so you see the T3, T4 from the follicular cells are responsible for what? Metabolism. And then the parafollicular cells produces calcitonin. They lower your blood calcium level. So when we ask you, okay, what are the functions of T3 and T4? What will be your answer? What are the functions of T3 and T4? What will be your answer? One answer. I just want a simple answer. One.
Please,
metabolism.
Regulate metabolic rate. Simple as that. Okay. What's the function of parafollicular cells?
The lower blood calcium level.
Simple as that. The lower blood calcium level. So in summary, okay, and again, we have a certain principle in the human body. Okay, we call something exchange electrolytes. Anytime calcium levels are going down, phosphorus levels go up. Please listen to this carefully. Then calcium level or phosphorus level and phosphate level It is a catch say calcitonin lowers your blood calcium level. The same as say a catch say calcitonin increases your blood phosphate level. Do you get it? Into kind textbook be calcitonin lowers your blood calcium. They will tell you calcitonin increases your blood phosphate level. The same. Add in here phosphate ne calcium. Your exchange electrolytes. Say phosphate calcium form. phosphate form calcium soro. Into seminya catcher will say calcitonin ma calcium kosra men bisa men could bisa textbook and start into one tro ese or ma phosphate soro. You have to know it's automatic. Anytime calcium levels are going down, phosphate level goes up. So when we tell you that, okay, the thyroid gland produces calcitonin, calcitonin lowers your blood calcium level, automatically you have to know that, okay, if it is lowering calcium level, then it means that it will elevate phosphate levels. Do you get that point? Please, do you get that point?
Yes.
And excellent. All right. So now let's move on quickly to the
Please, I
parathyroid.
have a question.
Yes, ask your question, please. Ask your question.
Sir, please, when there's an excess secretion of the when the parafollicular cells secrete excess calcitonin, is that one
Good.
to hyperthyroidism or is only associated with T3 and T4 cells?
Okay, so if there is no way the parafollicular cells alone will be working. They work simultaneously. So if the thyroid gland is overworking, say thyroid gland or juma broswa, saya no, and your friend hyperthyroidism. Obi and a thyroid gland no, or na juma e brosono, sa onipa ne yari or one your friend hyperthyroidism. Intersection say, sa onipa no. The body will be producing more of the T3. The body will be producing more of the T4. At the same time, the body will be producing more of the calcitonin. Untimi nka se thyroid gland no or produce calcitonin nkwa on produce T3, T4 or ye juma ni nyina boom. The two cells work simultaneous. Into the T3, T4 kosra calcitonin so be kosro. It means that patient will end up having what we call hypocalcemia. Why? Because calcitonin lowers your blood calcium level. Until calcitonin equals ubenya hypocalcemia. Please, have you gotten it?
So is it hypo or hyper?
Come again?
Sir, please, is it hypo or hyper?
Don't get confused with the increase. I'm not surprised. It's not the news at all. In anatomy and physiology, it's one of the things that confuse learners. Calcitonin kosra, calcium baform, CSI mass, calcitonin kosra, calcium baform. And another thing that is conflicting with your mind is that because calcitonin, the name looks like calcium, why do you say calcium? Because it's not surprise. It's something that confuses learners a lot. Because your brain is picking it from the word calcitonin. But calcitonin, calcium baform, write that mass principle down. When calcitonin goes up, calcium comes down. Why? The function of calcitonin is to lower your calcium level. Calcitonin, na yen say, calcium so etiba form. Into calcitonin, no say dose will move calcium beba form. Calcium back form and then a friend hypocalcemia. Okay, say calcitonin so esotia. What will happen to calcium?
Increase.
Well, in the patients, the calcitonin no so tia. That one, where will it happen? That one will happen in hypothyroidism. Say hypothyroidism, so no. As such as T3 beba form, T4 beba form, calcitonin so beba form. Calcitonin no na adwuma o ye ne say o ma wo calcium levels esote. Inti se oni ho a then the basic calcium level ne be kosro. As simple as that. They confuse you additional ne say wa adwene peke calcitonin abawura brain ne peke calcitonin to say calcium. Wa adwene you say calcitonin kosro calcium because we are forced to command the brain. Brain, don't learn it that way. Don't say it to your brain. Refuse to pick it that way. It confuses a lot of learners. And all the time, because we know it will confuse you, we examine you on that line too. Is that okay? Yes. So as calcitonin goes up, calcium comes down. When calcitonin goes down, calcium goes up. Is that okay? All right. That is fine. I hope your question has been answered, please. I hope your question has been answered.
Yes, sir.
Okay, so quickly, let's look at the parathyroid glands. Okay, let's look at the parathyroid glands.
So I have a question.
All right, how's your question?
So, about the hypothalamus and then the pituitary. When
That is
somebody
fine.
Alzheimer's disease, it's a disease yesterday I saw on a certain listing. They
Oh,
said it means
mention the condition properly.
Alzheimer's disease.
Hey, are you sure about that? Are you talking about Alzheimer's disease?
Yeah, yes.
Be
They
very
said
sure. Are you talking about Alzheimer's disease?
yes, it's ALZEHIEMRS.
Okay, that is fine. Alzheimer's disease. That is fine. So go ahead.
This I researched it and then they said it means the brain it doesn't keep memories and then it loses or it flashes off gradually. So does that mean that if such condition happens to somebody, like the brain doesn't function at all or what? I don't really
Okay, I
understand.
think you'd appreciate that better. This question would be better answered when we start looking at the nervous system. Is that okay? Yes, because the nervous system that we'll be talking about, how the brain works and all of that. I think this question does not really fit over here. Is that okay? Apart from the fact that probably with Alzheimer's disease, sometimes what you can say is that sometimes activities of the hypothalamus may sometimes be suppressed. So a person with Alzheimer's disease may have issues with their sleep regulation because some way, somehow, the hypothalamus also regulates the pineal gland. Is that so? They may have problems with their sleep regulation. They may have problems with their appetite, and they may have problems with their body temperature because some way, somehow, if hypothalamus activity is suppressed, okay, it's going to also affect thyroid gland activity, and that can affect how your body temperature is being regulated. That is one aspect of Alzheimer's disease. Okay, but for Alzheimer's disease, it's about the neurological aspect of the hypothalamus. Remember, hypothalamus is not just an endocrine organ. It plays a role in the nervous system, and it also plays a role in the endocrine system. Is that okay? Yes, but for all, ultimately, it's more of memory-related problem. Is that just that the patient may have some problems with, hypoactivity of the hypothalamus. Okay, all right, that is fine.
Okay.
That's fine. So this question, keep it down. We will use it to enhance our learning or our discussion when we start doing the nervous system. Is that okay? So Alzheimer's disease is about nervous. Okay, it's nervous system. So we will discuss it when we come back to the nervous system. All right, parathyroid glands. Now, where are these glands located? So glands we almost thyroid gland in the cheek. Can you see the thyroid gland? Now, the parathyroid gland, they are 4 in number. 4. Keep it in your mind. The parathyroid glands are hot. They are 4 in number. In anatomy, when we ask you what's the location of the parathyroid gland, they are located behind the thyroid gland. What is the location of the parathyroid gland? They are located behind the thyroid gland. What is the location of the parathyroid gland? They are located behind
the
thyroid gland. Is that okay? Simple as that. Okay. So how many are they? How many are the parathyroid gland? How many are they in number?
4.
They are 4 in number. Yes, they are 4 in number. Where are they located?
Behind the thyroid gland.
Behind the thyroid gland. Is that okay? And again, you also have to know the anatomical dimension. This is about 3 in terms of the length. These glands are about 3 to 8 millimeters long. Okay. Now, when we enter the parathyroid gland, we have 2 cells in the parathyroid gland. The 2 cells, the first cell, we call it the oxyphil cells. In fact, we have the first cell is the chief cells. We have the chief cells and we have the oxyphil cells. Say chief cells. Chief cells. And say oxyphil cells.
Oxyphil cells.
Say oxyphil cells.
Oxyphil cells.
Oxyphil cells.
How many cells do we have parathyroid gland? Yes. How many
4.
cells do we have in the parathyroid gland? How many cells do we have in the
2
parathyroid gland?
cells.
2
Yes.
cells.
Then when we ask you, how many are the parathyroid glands?
4.
Good.
4.
See, bisa question na ye into boasio science one. You bisa question na into boasie. How many are the parathyroid glands? 4.
4.
How many cells do we have in the parathyroid gland? 2.
2.
2.
And to boasie, you bisa one yan to boasie pe. What the confidence bet your wrong answer. Okay, so how many are the parathyroid glands? There are 4. How many cells do we have in the parathyroid gland? 2.
There are 2
What are the 2 cells? We have the chief
The
cells,
chief cells
cells
and then
and
we
the
have
oxygen
the
cells.
oxyphil cells. Now, the chief cells produces what we call the parathyroid hormones. Okay, so basically the parathyroid gland produces a hormone we call the parathyroid hormone. That hormone is actually produced by the chief cells. And then the oxyphil cells also helps the chief cell to produce the parathyroid hormone. I mean, yes, say parathyroid gland no cells in the womb. The can find the chief cell. They are tossed in the oxyphil cell. Now, oxyphil cell no produce parathyroid hormone. Sorry, chief cell no produce parathyroid hormone. Oxyphil cell no or what chief cell no man produce parathyroid hormone. Into me bisa say, what hormone is produced by the oxyphil cells? What will be your answer?
Chief cell.
Hey, take your time. I shall say, science we bisa question to relax so. What hormone is produced by the oxyphil cell? What's the chief cell? One can hormone. What's the chief cell?
Parathyroid.
Is the parathyroid hormone. Is that okay? Yes. So keep that in your mind. 2 cells in the womb, chief cell, oxyphil cell. Oxyphil cell need produce parathyroid hormone. Sorry, chief cell need produce parathyroid hormone. Oxyphil cell need boa chief cell need produce parathyroid hormone. Into bisa say oxyphil cell no hormone ben produce parathyroid hormone na obeka. Or boa no mani produce into betimi so aka so no one or produce. Is that okay? It's like you and your friend. We say your friend produces parathyroid hormone. You help your friend to produce the parathyroid hormone. So if I ask someone, okay, what hormone do you also produce? Is the parathyroid hormone. Please, have you gotten the principle? Is that so?
Yes,
we have
sir.
2 cells in the parathyroid gland: the chief cell, the oxyphil cell. The chief cell produces the parathyroid hormone. The oxyphil cell helps the chief cells to produce the parathyroid hormone. So, in summary, the oxyphil cells also produce the parathyroid hormone. Is that okay? Okay.
So,
Hot
please,
hormones.
can you
Yes,
say,
please. Yes, please. Go ahead.
please, can you say that so the hormones that the parathyroid gland produces is the parathyroid hormone? That's all.
Good. In some books, they call it parathyroid hormone. In some books, they even call it the parat hormones. Is that okay? So, in summary,
So, meaning the parathyroid hormone produces one hormone,
come again.
meaning that the parathyroid glands produces
Produces
one
one
hormone,
hormone.
which is
That
the
is it. Yes. It
okay.
produces just the parat hormone. The parat hormone. Is that okay? So the parathyroid hormone, we also call it the parat hormone. That is the only hormone produced by the parathyroid gland. The parat hormone. Okay. So we have 2 cells in the parathyroid gland. The chief cells and then the oxyphil cells. The chief cells produces the parathyroid hormone or the parat hormone. Okay. And then the oxyphil cells also help the chief cells to produce. Especially when you are aging, it helps your chief cells to produce the parathyroid hormone, especially when you are aging. So if we ask you what hormone is produced by the oxyphil cells, it's the same as the parathyroid hormone. Are we good? Now, what is the function of the parathyroid hormone? The parathyroid hormone helps to increase your blood calcium level. Say this after me. Parathyroid hormone increases blood calcium level. Say it. Parathyroid
hormone
increases
increases the
blood
calcium.
calcium level. Say it for the last time.
Parathyroid
Parathyroid
hormone
hormone
helps
increases the
increase
calcium
blood calcium level.
level.
Okay. Which hormone decreases blood calcium level? Which hormone decreases blood calcium level?
Calcitonin.
calcitonin.
Calcitonin. Which hormone increases blood calcium level?
Parathyroid hormone.
Which hormone decreases blood calcium level?
Calcium.
Calcitonin.
Calcitonin. Which hormone increases blood calcium level?
Parathyroid hormone.
Excellent. You passed. Excellent. Okay. Now, based on your understanding that parathyroid hormone increases calcium level, what would parathyroid hormone do to phosphates? Let me see those who can apply the principle.
That is the question again.
Based on your understanding that parathyroid hormone increases calcium level, what would parathyroid hormone do to phosphates?
So it will decrease.
Decrease it.
Why? Why?
Because when your calcium level is high, your phosphate levels goes down. And when your phosphate level is high,
Uko textbook bim. No more catch or say, Uko textbook natural say, parathyroid hormone, the function of parathyroid hormone is to lower your blood phosphorus level. Men konko kasi textbook near wrong. They chose which one to write. Into onya trust parathyroid hormone lowers your phosphorus level. It's the same as they telling you that parathyroid hormone increases calcium level. It's the same. Don't think that textbook is incorrect. It's correct. Okay, some textbooks can choose to use the phosphate in the definition, in the explanation. So some books, they will write, okay, parathyroid hormones, all they do is that they lower your blood phosphate level. And the same as they writing that they increase calcium level is the same thing in medicine. The same way the thyroid gland. You see the thyroid gland? The calcitonin lowers your calcium level. You see that function? I can choose to write that calcitonin increases your blood phosphate level. Is the same thing. Is the same. You have to learn and understand that. Say a trust calcitonin increases phosphate level. The same as calcitonin lowers calcium level. You have to learn for your brain to pick it. Into the moment you catch or say hormone be lower calcium level. So my picking it direct. Okay, hormone a lower calcium level there and opeja phosphate levels. You have to get it automatic because the textbooks will not repeat. Okay, so when we tell you that parathyroid hormone, okay, and if I ask you that, okay, write two functions of parathyroid hormone, it's simple. They increase blood calcium level, they lower blood phosphate level. Have you gotten it? Please, have you gotten it? Good, excellent. Okay, so the thyroid gland anatomy is very simple. This gland is also called the epithelial bodies. In terms of the length, it's about 3 to 8 millimeters long. Where is it located? This gland is located behind the thyroid gland. Okay, good. How many are they in number? They are 4 in number, but within each of them, we have 2 cells. What are the 2 cells? The chief cells and the oxyphil cells. What's the function of the chief cell? It produces parathyroid hormone. What's the function of the oxyphil cells? Especially in aged people, the oxyphil cells help support the chief cells to produce the parathyroid hormone. What's the function of parathyroid hormone? The parathyroid hormone helps to increase your blood calcium level. At the same time, it helps to decrease your blood phosphate levels. Simple as that. Is that okay? Simple as that. Okay. Quickly, let's look at the adrenal glands. Any question on the parathyroid hormone, please? Any question on the parathyroid gland and the hormones? Any question on the parathyroid gland and hormones?
No, please.
Okay, that is fine. Who can summarize the parathyroid gland? Yes, who can summarize the parathyroid gland? Yes,
Sir,
who will
can I
summarize the
try?
parathyroid gland? Yes, try.
Okay. So the parathyroid gland is behind the thyroid hormones, and
Excellent.
they are 4 in numbers, but
Okay.
has 2 cells, which is the chief cell and the oxyphil cell.
Okay.
The chief cell releases or produces parathyroid hormone, and the
Okay.
oxyphil helps the chief cell to produce that hormone. The parathyroid hormone increases the calcium level in the blood.
Okay.
Yes, sir. Yes, that's it.
Okay. That is fine. That is excellent. Yes, that is excellent. So quickly, let's look at another gland we call the adrenal gland. Now, another name for this very gland, adrenal gland, we call it the suprarenal gland. Why do we call it the suprarenal gland? Now, look at the location of this gland. See, this gland sits on top of the kidney like a cap. Look at the kidney. Can you see the kidney? There's the kidney. You see the kidney. This gland is on top of each of the kidneys. So if I ask you that, okay, how many adrenal glands do we have? What would be your answer? How many adrenal glands do we have?
Two.
So
2. Why 2? Because we have 2 kidneys. Each
We
of
have
them is
2
on each of the
kidneys.
kidneys. Is that okay? So we have 2 adrenal glands. Is that okay? We have 2 adrenal glands. Okay, and each of them sit on top of each of the kidneys. Okay, so we have 2. That's why we call it suprarenal glands. You know, the kidney is also, another word we use for the kidney is renal. Suprarenal gland. Why? It's related to the kidney. It's on top of the kidney. Suprarenal. Is that okay? So this is how this gland looks like, the adrenal glands. Now, in anatomy, gland wing is divided into 2. Please listen carefully. Anatomically, this gland is divided into 2. We have the adrenal medulla and we have the adrenal cortex. Say adrenal medulla. Say it. Say adrenal medulla.
now medulla.
Say adrenal medulla.
Adrenal
Medulla.
Cortex.
adrenal
cortex.
This gland is divided into 2. Adrenal medulla. And then we have the adrenal cortex. Into gland we anatomy based on the hormones they produce. The first division, your friend adrenal medulla, and no middle part of the gland. And the second division, your friend adrenal cortex. Second division, no, your friend cortex, let me take it again. This gland anatomically is divided into 2. In no, your friend adrenal medulla, and hono, your friend adrenal cortex, and hono, into 3 zones. Zone is kind wa bonten pan, your friend is zona glomerulosa. Zone 115, your friend is zona fasciculata. Zone ben middle part, your friend medulla. Okay, your friend is zona reticularis. Okay, this is the diagram. So look at the diagram. I said anatomically, this gland is divided into how many divisions?
2.
Okay, what is the name given to the innermost division?
adrenal
Medulla.
Medulla. And what is the name given to the outer division?
Adrenal cortex.
cortex.
Further divided into how many zones?
3.
3 zones.
What's the name given to the outermost zone?
Zona glomerulosa.
Middle zone. What's the name given to the middle zone?
Zona fasciculata.
And what is the name given to the zone closer to the medulla?
Zona
reticularis.
That is fine. So if we ask you that the adrenal gland has 2 anatomical zones, what are the 2 anatomical zones? the adrenal medulla, and the adrenal cortex. The adrenal cortex is further divided into 3 zones. The 3 zones, the outermost zone is the zona glomerulosa, the middle zone is the zona fasciculata, and then the zone closer to the medulla is the zona reticularis. So if I ask you in exams that, okay, which zone of the adrenal cortex is closest to the medulla?
Zona reticularis.
Which zone of the adrenal cortex? Which zone of the adrenal cortex is far away from the medulla?
Zonal
Okay, so
glomerulus.
fascia wajim. Adrenal gland no in anatomy you're dividing into 2 zones. Zone na won't finfini no. Sorry, you're dividing into 2 divisions. Middle part your friend adrenal medulla. Outer part your friend adrenal cortex. Adrenal cortex no, so you're dividing into 3 zones. 3 zones, you know. Zone na a war outside part your friend zona glomerulosa. The zone in the middle is called zona fasciculata. And then the zone closest to the middle, which is the medulla, is called zona reticularis. Is that okay? Good. Now, the middle zone that we call the medulla, the hormones they produce are 3. We have epinephrine, norepinephrine, and then we have what we call dopamine. Epinephrine, norepinephrine, and dopamine. Okay, together, all the hormones produced by the medulla, when we put all of them together, we call them catecholamines. Say catecholamines. Say catecholamines.
Catecholamines.
Again, say catecholamines. Gland in finfino or produce hormones miensa, epinephrine, norepinephrine, and last one, your friend dopamine. Sa hormones miensa say come nyina boma. Some books, almost friend medullary hormones, and now so bit me from catecholamines. Into say, what are the medullary hormones? What are the adrenal medullary hormones? The medullary hormones are 3: epinephrine, norepinephrine, and catecholamines. What are the medullary hormones, or what hormones do we call catecholamines? What would be your answer?
Epinephrine.
Yes. Yes.
Epinephrine and non-epinephrine.
Epinephrine, norepinephrine, and the last one. The last one is called
Catecholamine.
no, please.
Dopamine.
The last one is not catecholamine. So they say medullary hormones. You can't munina bomwa and you from catecholamines. If you can't say bobo medullary hormones, so true catecholamines are wrong. Medullary hormones no me miensa. Epinephrine, norepinephrine, and the dopamine. Omo miensa ne ye can't bomwa and you from catecholamines. In the make this say okay, mention the catecholamines are epinephrine, norepinephrine, and dopamine. Is that okay? If we ask you to mention the medullary hormones, you can't say catecholamines. You've not said anything. Is that you have to mention epinephrine, norepinephrine, and dopamine. Is that okay?
Yes.
All right. That is fine. And then when we also ask you to mention the cortical hormones, and when you take the zona glomerulosa, hormones produce. Offer zona fasciculata, almost hormones produce. And offer zona reticularis, almost hormones produce. Zona glomerulosa, produce aldosterone. Zona fasciculata, produce cortisol. Zona reticularis, produce androgens. Zona glomerulosa, produce aldosterone. Aldosterone no one your friend mineralocorticoids. Aldosterone the different fry friend mineralocorticoids. Okay. Zona fasciculata, produce glucocorticoids. Glucocorticoids ni different fry friend and on your friend cortisol. And na zona reticularis, produce androgens. Androgens no In some textbooks, some of any dehydroepiandrosterone. Okay, good. So we have when we ask you to mention the cortical hormones, we say medullary hormones, no one offend the catecholamines, no. The cortical hormones, no, it means that the hormones produced by the zona glomerulosa, the hormones produced by the zona fasciculata, the hormones produced by the zona reticularis, they are also called the cortical hormones, adrenal cortical hormones. Mention the cortical hormones. It means you have to mention the hormone produced by the zona glomerulosa, that is aldosterone, the hormone produced by the zona fasciculata, that is the cortisol, the hormone produced by the zona reticularis, that's the androgens. Is that okay? What hormone is produced by the zona glomerulosa?
Aldosterone.
Okay. What hormone is produced by zona fasciculata?
Cortisol.
Cortisol. Yes. What hormone is produced by zona reticularis?
Aldosterone.
Androgens. Hey,
Androgens.
who said aldosterone? Zona reticularis. It's
Androgens.
or dehydroepiandrosterone. Androsterone. Okay. All right. That is fine. Okay. Which part of the adrenal gland produces? Yes, ask your question, please. Ask your question.
Sir, please, you said another name for the aldosterone is what?
Mineralocorticoids. Mineralocorticoids. Into a kind of textbook, look who see actual mineralocorticoids are and one your friend aldosterone. Okay, mineralocorticoids. You can mineralocorticoids. We are talking about aldosterone. Okay, and you can glucocorticoids is the same as cortisol. Okay.
Stop.
Which part of the adrenal gland produces epinephrine? Adrenal medulla. Okay. Which part of the adrenal gland produces the catecholamines?
So the adrenal medulla.
Adrenal medulla. Okay. Mention the hormones that are called catecholamines.
The epinephrine.
So the epinephrine
and the dopamine.
You see the epinephrine, and one is epinephrine, and one is adrenaline. Epinephrine, the back is adrenaline. No epinephrine, the back is no adrenaline. No epinephrine, the back is no adrenaline. And epinephrine, the back is adrenaline. It is a who textbook almost adrenaline, the same as epinephrine. Okay, almost no adrenaline, the same as no epinephrine. Okay, and then we have the dopamine. Is that okay? In fact, we have a lot. Some textbooks we even mention chromafins. Just that medullary hormones, the catecholamines, they endorse pie if medulla no. Epinephrine, no epinephrine. Dopamine actually. Dopamine is just a little amount that is produced in the medulla. Okay. Which part of the adrenal gland produces glucocorticoids?
Zona fasciculata.
Which part of the adrenal gland produces androgens?
Zona reticularis.
Listen to this question. Which part of the adrenal gland produces androgens and epinephrine?
Zona recto.
Adrenal medulla.
Yeah.
So let me use this question to show you how students sometimes you give wrong answers and get low marks. Question is saying, which part of the adrenal gland produces epinephrine and then androgens? Who questions are into tra obetobo. Now the question is asking you which part of the adrenal gland produces epinephrine. So you go, okay, the part of the adrenal gland that produces the epinephrine is the adrenal medulla. Then you continue. The part of the adrenal gland that produces the androgens is also the adrenal cortex, specifically the zona reticularis. when you are answering question, you have to take your time. Sometimes you have to think about it a lot before you put it on the paper. And sometimes you can even sketch what you actually want to write. Read it severally before you transfer it to the original paper itself. Is that okay? Because you see, most of you would have attempted and just answered and said medulla. It's not the medulla alone. Because the question is asking you epinephrine and androgens. So the epinephrine is produced in the medulla. The androgens is produced in the cortex, specifically the zona reticularis. Is that okay? Okay. Which part of the adrenal glands produces mineralocorticoids and dopamine?
Sir, the
Yes.
corticoid is produced by the zona glomerulasa.
Hey,
glomerulosa.
Excellent. Good.
The dopamine is the adrenal
The
medulla.
dopamine is the adrenal medulla.
But yes, I'm so trying to say, I'll go to be now answer. Come on. You get all the score you deserve. That is how we answer questions. Okay. So because the question is in two folds, and most of the time, if you ask students a question in two folds, so I read two bizarre question in two folds, then the brain not turning around. Okay, so if we ask you a question in two folds, don't answer the first portion and drop the other. You have to answer the two fold, else you get a full marks. Okay.
Yeah, please,
so
I don't understand.
You don't understand which part, please? Which
Yeah,
part don't you understand?
Just this part where we are talking about right now.
Oh, we asked you a question. Okay, we asked you that which part of the adrenal gland produces mineralocorticoids and epinephrine? Okay, which part of the adrenal gland produces epinephrine? Do you understand that part?
No, please.
Oh, then it means you didn't join us early. It means you didn't join us early.
The epinephrine is the adrenal medulla.
Good. Yes, epinephrine is the adrenal medulla. Yes, and then mineralocorticoids is the zona glomerulosa. So, and now we are asking you a combined question. Which part of the adrenal gland produces epinephrine and mineralocorticoids? So we are asking you two questions here in one. So you have to tell us the part that produces the epinephrine and also tell us the part that produces the mineralocorticoids. Okay, so in a question like that, you have to tell us, okay, the part that produces the epinephrine is the adrenal medulla. The part that produces the mineralocorticoids is the zona glomerulosa. Then you get your full mark. Is that okay? All right, that is fine. Okay, last question. Which part of the adrenal gland produces cortisol and dopamine? Cortisol and dopamine.
The cortisol is produced in the zona
fasciculata.
Okay. Dopamine.
And then the dopamine is the adrenal medulla.
Excellent. It shows that you've passed the test. So cortisol is produced in the zona fasciculata of the adrenal cortex. And then dopamine is produced in the medulla of the adrenal gland. Simple as that. Is that okay? Simple as that. Okay, so that is the adrenal gland for you. So anatomically, the adrenal gland is divided into. So if I ask you to, okay, list all the hormones produced in the adrenal gland, what will be your answer? All the hormones produced in the adrenal gland. You see, this time, look, this time I say all. So it means that, how will you answer this question? All the hormones produced by the adrenal gland, how will you answer it?
So, say you answer the hormones produced in the cortex and the medulla.
Good.
The hormones that produce.
That is brilliant. It shows that you've gotten it. Good. It means that you have to list the hormones in the medulla and list the hormones from the cortex. So you list. You start in a question like that. You start for the adrenal medulla. The hormone produced there, we have the dopamine, epinephrine, norepinephrine. For the adrenal cortex, the first zone, the zona glomerulosa produces aldosterone. The zona fasciculata produces cortisol. the zona reticularis produces androgens. You see how simple it is? Very simple. And so usually in exams, those who know what they are supposed to write, you see their answers are simple. 1 page, they are done.
Say, I want to ask
a question. Yes, ask your question, please.
So with this question that you ask, and probably in examination, I am answering this question. And I listed the hormones that are being produced by the medulla, like the epinephrine, and the dopamine. But when I got to the cortex, I forgot the names of the zonal. That's the zonal glomerulasa, zonal fasciculata, and the zonal reticular. And I said the cortex or the adrenal cortex hormones are the cortisol, the aldosterone.
This question was very
that
specific.
One is it correct or
yes? I've gotten your point. This question was very specific. In a question like this, we need the hormones. You get it? Because the question says list all the hormones produced by the adrenal gland. So I don't
without
want you to
mentioning the zone now, you are okay.
The zones. Good. We just want you to list the hormones. So epinephrine, norepinephrine, dopamine, but a student that will also take the time and list the zones and then attach the hormones specifically. Don't expect that student to get the same marks with you. That student needs tertiary and professional attention. Or exhibitors or a tertiary student. Because a tertiary student, you don't answer questions lateral like any other person. You answer questions with, backends. There should be rationales. Yes, one of these days, I will come and show you how one of the best students, their exams papers, so that you see how exceptional student, how they answer their questions. There are students who are exceptional. Yes. The recent anatomy, someone was able to get 98. And they answer the questions like they are teaching. Yeah, you could see this person is learning, someone who have really learned. That's how you have to learn. So don't always be like, give me a person make church or answer and make up. No. If that and that, you can be good, but your scores may not be up. Maybe you get 85. You could have gotten 95. You can still pass and get your A, but you could have gotten 95 or even the 98 or even sometimes 100. Is that so? Sometimes beef up your explanation, especially when you've read the area. Try and beef up your explanation with some more details. Is that it makes you unique. All right, that is fine. So that is it about the adrenal gland. Is that okay? That is it about the adrenal gland. Yes.
Sir, please, I have a question.
Yeah. Okay. Ask your question, please. Ask your question.
Okay, sir. According to your teachings, we have 2 adrenal glands on the kidney, located on both sides of the kidney. So the renal medulla, the renal cortex, are on each of the kidneys.
Okay.
So if in any case a question comes that how many if a question comes like how many hormones are there in the 2 pairs of the adrenal glands?
Oh, it's still the same hormone. I understand how technical you want to think, but it's still the same hormone. If we ask you how many hormones are there, you can't say aldosterone is 2. The hormones can be 2. You can't say 2 aldosterone. No, it's not said. It's not mentioned that way. You can't also say 2 mineralocorticoids. No. But in terms of the gland itself, then we can number the glands. But you can't number hormones. Hormones are chemicals. So you can't say 2 aldosterone. You can't say 2 mineralocorticoids. You can't say 2 androgens. No. It's androgen. The one produced by the zona reticularis at the left adrenal gland, and the one produced by the zona reticularis at the right adrenal is the same. Okay, so you can't say 2 androgens, 2 mineralocorticoids, 2. It's not mentioned that way. Is that okay? Yes, I've gotten how it's nice that you are thinking technical that way.
Yeah.
But so your question will come in if I ask you that. Okay, how if I try, but I wouldn't even be that technical. I just want you to just get some detail. But I'm looking at how you can apply how you are thinking now. If I should ask you, okay, how many adrenal glands do we have? That is when you can say 2. Is that And if I also have to, if I want to be more technical, I can say that, okay, how many adrenal medulla can we have? Then that one to pair the lines you are taking. Oh, examine per the lines you are thinking. Yes, per the lines you are thinking, then you can say that, oh, okay, then we will have 2 adrenal medulla, because we say right adrenal gland or no adrenal medulla, left adrenal gland or no adrenal medulla. So that one you can see 2 adrenal medulla. And the cortex, we see about right adrenal gland on the cortex, left adrenal gland on the cortex. So you can say 2 adrenal cortices. Okay, then the divisions of the cortex, the zona glomerulosa, you can say we have 2 adrenal zona glomerulosa for the left one and for the right one. I mean, examine
We pray that for
all
you,
right.
sir.
But that is fine. But that is fine. That is fine. It's good that you're able to think. It's good that you're able to think that deep. It shows that you are getting what we are. It shows you are developing in anatomy. It's good. All right. Any other questions?
Sir, yes, please.
Good. Go
Sir,
ahead.
please. When the adrenal glands are producing their hormones, do they do that simultaneously or alternatively?
Simultaneously. Into say you can say your adrenal gland is overworking. Into fan say will be a problem. Now say adrenal cortex no if you check that patient, you see that the medulla and the cortex, all of them will be working, will be hyperworking. Okay. If the adrenal cortex is overworking, you can't say the adrenal cortex no is overworking. It's only the glomerulosa that is overworking. So if the zona glomerulosa is overworking, simultaneously you see the fasciculata will be overworking, the reticularis will be overworking. Some way, somehow, the medullary will also be overworking. Okay, and if the adrenal gland is underworking, okay, you will notice that the cortex, the zones there will be underworking. Simultaneously, you will notice some level of underworking also in the adrenal medulla. Condition a about adrenal gland, then a friend, your Addison's disease and Cushing syndrome. So adrenal gland, no, say najuma forma medicine when your friend Addison's disease. Adrenal gland or majuma ecostra. Meaning say adrenal gland hormones no mu produce aldosterone ecostro, cortisol ecostro, androgens ecostro. So I are in medicine when you find Cushing syndrome. Cushing syndrome both from na yen kete or manima and say moon face. No mo fu ekese. No mo omo buffalo hump. So I are in your friend adrenal hypersufficiency. Means adrenal gland ne ye juma ebroso. Okay, so our patients no kosha, but usually the problem, a patient having Cushing syndrome, go and read. Usually the problem is at the zona fasciculata, but you will notice that that patient will be having issues relating to increased aldosterone, and then also having problems relating to increased androgens. And into this, our patients or your bowels in our body enough because of the androgens. Is that because of the androgens? Okay, and say patient, we have what we call adrenal insufficiency, and then your friend Addison's disease. Meaning say adrenal gland na adwuma ye no aba form. Adrenal insufficiency. And then say your friend Addison's disease. In Addison's disease, no, on can say because of say problem, no, adrenal glomerulosa no. Because of say problem, no, zona glomerulosa no. Zona fasciculata enyeshe, zona reticularis enyeshe. Omu nyina be affecte womo. So problem is in the glomerulosa. Be affecte fasciculata ne kakra, be affecte reticularis ne kakra. Be san kwa affecte medulla ne kakra. And your condition, your bin so ho no so affecte medulla ne nko. So what say we have a disease we call pheochromocytoma. Pheochromocytoma. Bia say medullary hormones ne costro. Medullary hormones no say we epinephrine and dopamine. Say almost costro bebra. Say ya when your friend pheochromocytoma. It is our patient to be checking the BP na high, the pulse rate high, temperature high, BBI high. But we say ya no problem no e medulla nim. But on can say be see medulla nko a. Say patient to be checking no both na aldosterone so akostro kakra, cortisol akostro kakra, androgen so akostro kakra. That is how it is. Please, I hope your question is answered. A simultaneous lady.
Yes, please.
Excellent. That is how
Thank
it works.
you.
Okay. So if there is a problem in one aspect, a division, simultaneously, there will be some level of effect in the other division. That is how it works. Is that okay? Great. All right. That is fine. So that is it for the adrenal cortex, the adrenal gland. But it shouldn't end there. Okay. It shouldn't end there. You see, the zona glomerulosa produces the aldosterone or the mineralocorticoids. You have to know the function of the mineralocorticoids. Okay. Now, mineralocorticoids, no, aldosterone, or kidneys, no, salt, back. But don't forget that anytime salt is going back into your blood, water follows. What's the function of the aldosterone? 1, it helps to reabsorb salt. 2, it helps to also reabsorb water. That is the second function of aldosterone. And again, will be a friend exchange electrolytes. Parathyroid gland. I taught you something we call exchange electrolyte between phosphorus and then calcium. When calcium is going up, phosphorus goes down. We also have an exchange electrolyte between sodium and potassium. When sodium is going into the blood, potassium leaves. So if I tell you that aldosterone helps to reabsorb sodium into the blood, it means that aldosterone helps you to excrete potassium. That is also an exchange principle there. Okay, so if a textbook tells you that, okay, aldosterone helps you to reabsorb sodium, automatically you should know. Then the same aldosterone will also help you to excrete potassium. Simple as that. Okay, so aldosterone has 3 functions. 1, it helps you to reabsorb sodium. It helps you to reabsorb water. It helps you to excrete potassium. Is that okay? How about the zona fasciculata? It produces the cortisol. What's the function of cortisol? Cortisol is an anti-inflammatory agent. Cortisol is an anti-inflammatory agent. Again, cortisol performs a function we call gluconeogenesis. When we say gluconeogenesis, there are times that your blood sugar can go down. What cortisol can do is that cortisol can help your body to convert lipids, fat, and protein back into sugar for your body to use. Is that okay? And then we have the androgens. The androgens are basically sex hormones. The androgens, they are sex hormones. Simple as that. They help in your physical development, okay, especially in males. They are sex hormones, okay. Then the medullary hormones. The medullary hormones also plays a role in your fight and flight response. Is that okay? So the medullary hormones, the epinephrine, for example, epinephrine will help to increase your respiratory rate. Epinephrine can increase your BP. Epinephrine can increase your pulse rate. Epinephrine can increase the activities in your body. Norepinephrine will rather decrease activities. So the medullary hormones plays a role in increasing or decreasing activity in your body. So it shouldn't end at you just knowing the zones and then the hormones they produce. You should know the functions of the hormones. So when we ask you what's the function of aldosterone, it helps you to reabsorb salt, help you to reabsorb water, help you to excrete potassium. What's the function of the zona fasciculata? The glucocorticoids. Glucocorticoids or the cortisol, they play a role in anti-inflammatory. They suppress your immune system. And that is very good, especially in autoimmune diseases or super infectious diseases. Okay. Then we have the zona reticularis. They produce the androgens. Androgens are basically sex hormones. It's as simple as that. Catecholamines, what do? They are responsible for fight and flight response. Fight or flight response. And that simply means they are responsible for increasing or decreasing your heart rate, increasing or decreasing your BP, increasing or decreasing your glucose metabolism. That is simply that. Is that okay? All right. That is fine. So basically, that is it for the adrenal gland. That is it for the adrenal gland. Okay. The plan was to close at 6. I think we have 7. 6. We have 7 more minutes. 7 minutes. I will use it to introduce you to the pancreas. This is exactly the point I got to with the nurses. Okay, so I'll use the rest of the minutes to introduce you shortly to the pancreas. Okay, now quickly, let me show you how the pancreas looks like. So look at this, the pancreas. This is how the pancreas looks like. Now, when we ask you the anatomical location of the pancreas, but even before that, there is something interesting about the pancreas. This pancreas is both an exocrine gland and an endocrine gland. So in anatomy, we say it's a mixed gland. The pancreas is a mixed gland. Keep it in your mind. The pancreas is a mixed gland. The pancreas is a mixed gland. Why is it a mixed gland? It's a mixed gland because it performs both exocrine function and also performs an endocrine function. The pancreas is what? It's a mixed gland. Why is it a mixed gland? It performs both what? Endocrine function and exocrine function. So keep it in your mind that the pancreas is a mixed gland. Why is the pancreas a mixed gland? It performs both endocrine function and exocrine function. Okay, great. Now, if we take the endocrine pancreas, once the pancreas, look at how the pancreas looks like. Now, looking at how big the pancreas looks like, you see, actually, two parts: endocrine function or exocrine. Now, the endocrine part of the pancreas, okay, the endocrine part of the pancreas, okay, it constitutes of just 2% of the total pancreatic tissue. The endocrine part, okay, endocrine part of the pancreas, just 2%. That should tell you that exocrine pancreas is 98%. So if I ask you that, okay, which between exocrine pancreas and endocrine pancreas, which of them dominates in the pancreatic tissue? What would be your answer? Between endocrine pancreas and exocrine pancreas, which of them dominates in the pancreatic tissue?
Exocrine pancreas.
The exocrine pancreas. That is about 98%. It tells you the exocrine pancreas is very big. Okay, it tells you the exocrine pancreas is very big. Is that okay? That is something important that you have to know. Now, the pancreas anatomically is also divided into 3. So this is what we call the tail. This part of the pancreas, we call it the tail of the pancreas. The part that is far away from the head, we call it the tail of the pancreas. And then we have the body of the pancreas. The body of the pancreas is the portion of the pancreas between the head and the tail. And then we have the head of the pancreas. The head of the pancreas is the portion of the pancreas that sits inside the duodenum. So when we ask you what is the head of the pancreas, the head of the pancreas is the portion of the pancreas that sits within the duodenum. What's the body of the pancreas? The portion of the pancreas between the head and the tail. Okay. What is the tail of the pancreas? The portion of the pancreas that is far away from the head and the body. That is the tail of the pancreas. Okay. In some textbooks, they will also label the neck of the pancreas. Okay. The neck of the pancreas is the region that divides or separates it from the region that demarcates it from the head. The region that is separating the head from the body. We call it the neck. This region. Look at the region. Look at where the cursor is here. We call it the neck of the pancreas. It's a region. The region between the head and the body, we call it the neck of the pancreas. So the pancreas is having 4 anatomical parts. We have the head, we have the body, and we have the tail. The head, the body. If I ask you in exams that which part of the pancreas sits within the duodenum, what would be your answer?
The head.
The head.
The head. Which part of the pancreas is between the head and the tail?
The body.
The body.
The body. Is that okay? Which part of the pancreas is far away from the duodenum?
The tail.
The tail. Simple as that. So just be smart. Is that okay? Just be smart. Those are some basic anatomy questions they can ask you on the pancreas. Okay. So when you enter the pancreas, so you see, this is how the pancreas. Let's go quickly. Let's go quickly to the pancreas. When you enter the endocrine pancreas, we have these cells there. Okay, the endocrine pancreas, we also call them the islet of Langerhans. In the pancreas, your endocrine pancreas, your exocrine pancreas. Endocrine pancreas, your cells, 5 anyway. Endocrine pancreas, your cells, 5 anyway, endocrine pancreas. Cells Mako 5 no. The D can friend alpha cells. The tossum you friend beta cells. The tossum you friend delta cells. The tosso and 9 your friend PP cells. And I'll be to me pancreatic polypeptide cells. Okay. The tosso enum your friend epsilon cells. So in the endocrine pancreas, we have 5 cells inside. The alpha cells, the beta cells, the delta cells, the PP cells, and the epsilon cells. The alpha cells produces a hormone we call glucagon. The beta cells produces a hormone we call insulin. The delta cells produces a hormone we call somatostatin. What's the somatostatin? Do you remember somatostatin?
Yes.
Which other organ produces somatostatin?
The hypothalamus.
Hypothalamus. Hypothalamus. What is the work? Sorry, what is the work of somatostatin? It's a neutralizing hormone. Neutralizing. Into endocrine pancreas. Say alpha cells produce glucagon does one. Obe produce somatostatin and neutralizing glucagon. Say beta cells produce insulin, not insulin does one. Obe produce somatostatin and neutralizing insulin. We have the pancreatic polypeptide cell. Or produce pancreatic polypeptide cells, not ebe does one. No, produce somatostatin and neutralizes our hormone. Okay. Now say we have the epsilon cells. Epsilon cells they produce ghrelin. Okay, we call it ghrelin. Say ghrelin also be does one. No, produce somatostatin and neutralizes ghrelin. Okay, so the endocrine pancreas, we have 5 cells inside. The alpha cells. What hormone is produced by the alpha cells?
Glucagon.
What hormone is produced by the beta cells?
Insulin.
What hormone is produced by the delta cells?
Somatostatin.
Yes. What hormone is produced by the PP cells?
Pancreatic polypeptide.
Pancreatic polypeptide or peptide hormone. What hormone is produced by the epsilon cells? Ghrelin. Say ghrelin. Ghrelin. Good.
Ghrelin.
Let's say this together. Alpha cells produces glucagon. Say it. Alpha cells in the endocrine pancreas produces glucagon.
Alpha cells in the pancreas produce glucagon.
Insulin.
Beta cells
produce insulin.
Somatostatin.
Delta cells
produce somatostatin.
Say it. Say PP cells produces pancreatic polypeptide.
PP cells produces
Pancreatic polypeptide.
Epsilon cells produces ghrelin.
Epsilon cells produces ghrelin.
Now let's do a simple exercise. This is the last page we will end on. What cell in the endocrine pancreas produces glucagon?
Alpha cell.
Alpha cell.
Pancreas produces ghrelin.
The epsilon.
Epsilon cell.
What cell in the endocrine pancreas produces somatostatin? Cell in the endocrine pancreas produces insulin.
Beta cells.
Beta cells. So that is it. So now the key thing I want you to learn with the pancreas is that understand that another name for the endocrine pancreas is called islet of Langerhans. Into the pancreas. Now we say endocrine pancreas, the cells are in the room. Only 5. 1, 2, 3, 4, 5. Into open pancreas, look at how the pancreas look like. Into endocrines have 5 cells now. Omo boa mo 5 no mako se baby. Into here, we say oma boa mo 5. Into beta bako, delta bako, alpha bako, PP bako, epsilon bako, no mako se baby. Into the from islet of Langerhans. Into cells 5 no e bi boa mo baby no mako se baby or pancreas ni. They are scattered within the pancreas. Is that okay? So you could see the diagram. You see 5, 5, 5. 5, 5, 5, 5, 5, 5, 5, 5, 5, 5. Is that okay? All right. So I think we can end here for today. We can end here for today. All right. Any questions?
Sir.
Yes, please.
Please, I want to ask last question.
Okay, please ask your question.